Hi friends, welcome back to the channel. I'm going to be doing a little mini series over the next coming weeks about skincare in pregnancy and treatments that are safe to do in pregnancy. I apologise if that is boring to some of you because maybe you're not pregnant and never have any intention of being pregnant, but this is my channel and I just do this for a laugh. And it was relevant to me, so I thought let me make a few videos about it. So you'd think I'd really have to switch up my skincare when I became pregnant. In case you haven't been keeping up with the news, I'm currently 7 months at the moment. But actually, I was always kind of a bit lazy with my skincare anyway, so I didn't really have to change it too much. When I say lazy, I mean lazy for someone who works in this particular field, not using Vaseline all over my face every week sort of lazy. The advice from most of the skincare manufacturers and doctors at the moment is to stop using a lot of the actives, and that's not because there's necessarily a problem with using the actives, it's more just that there isn't any evidence that it's safe. A lot of the papers that we have are actually from animal studies, because you can imagine it's quite difficult to do a study looking at human pregnancies and then giving them retinol and then seeing what rate of birth defects they would have. You can't really do that. So I'm going to go through a few ingredients that you should definitely avoid and why, and also let you know which ingredients I would recommend still using and why. You might find some of them a little bit surprising. Let's just quickly discuss the kinds of issues that you might face during pregnancy, because there are some skin and hormonal changes which take place, obviously. So as you can see, we have quite a hormonal shift, and there is also an increase in circulating blood volume. And this can cause problems such as acne, skin sensitivity, dry skin, rosacea, melasma, which is also called the mask of pregnancy, and an increase in hair growth. My own personal experience was in the first trimester, I had acne on the face and a little bit on the neck, which was not great. And then in the second trimester, that pretty much went and I had the best skin of my life, which is now gone. I have to say, I was looking pretty good in the second trimester because I was throwing up so much in the first. I lost loads of weight. Let me just reference this Linda Evangelista video that we did. Look at that. I haven't been that skinny in years. If there was some way to kind of bottle that weight loss and sell it, well, I wouldn't need to make these videos anymore. Let's put it that way. But I still would, because people need to know. Okay, so let's do the avoids first. Number 1, hydroquinone. This one's kind of obvious. You'll find it in products such as Obagi Medical, Obagi ZO, and you may also find it in compounded skincare. So hydroquinone is used for hyperpigmentation, and the fact that you can't use it during pregnancy is somewhat ironic given the fact that you're going to probably see an increase in the melasma. But unfortunately, it's just something that you're going to have to wait to sort out till after the baby's born and you finish breastfeeding. Hydroquinone is a type of phenol which is used for hyperpigmentation. In higher percentages, it's also used for whitening the skin, but we don't really use it like that. The main issue with hydroquinone is the absorption. So you're going to absorb about 35 to 45% of all the hydroquinone that you put on the skin, and this can lead to skin sensitivity, which is super interesting because you'd think it would be a teratogen or something like that and cause birth defects. So this is a very small study of only 68 women in Senegal. They were using hydroquinone and topical potent steroids. There were no reported birth defects. However, those using the steroids had a smaller placenta and a higher rate of low birth weight infants. That's a super small study. It doesn't really mean anything because obviously 68 women is not a lot. So obviously the safest thing to do is don't use it. However, if you have used it by accident and you didn't know that you were pregnant, don't worry. I'm not an obstetrician, but it takes around 8 to 12 weeks for the placenta to start working properly. So the chances are if you've stopped earlier than that, you're not going to have anything passing across anyway. The next one, point number 2, are retinoids. So with this, I'm talking about stuff like tretinoin, adapalene, oral isotretinoin, and also the non-prescription retinols that you might get just in the drugstore or Sephora or somewhere like that. So the interesting thing about vitamin A is in a paper after application of 0.05% tretinoin, the blood levels remained unchanged. Interestingly, there are 4 published case reports of birth defects associated with topical tretinoin use. However, the role of topical retinoids in these cases remains controversial. Obviously, 4 is not a huge number. And interestingly, there are 2 prospective studies that look at the use during first trimester of pregnancy with 96 and 106 women, which did not find an increased risk of major malformations or any issues with the baby. Obviously, they are not huge numbers either. I just want to talk around the topic of using vitamin A a little bit now. So what happens if you're taking oral isotretinoin and you do become pregnant? All patients are counselled on the use of 2 forms of contraception at least whilst they're taking isotretinoin, so the chance of that happening is very low. However, in one study of 115 pregnancies, 18% spontaneously aborted. Of the live births, 65% of them were healthy infants. 28% of the live births had congenital malformations consistent with isotretinoin embryopathy, and 7% had other problems. In another study of 36 pregnancies, 22% spontaneously aborted. Of the live births, 82% were healthy infants, and 18% of the live births had congenital malformations. What kind of abnormalities are we talking about here? So the main abnormalities are craniofacial, central nervous system, cardiovascular, and thymic. The craniofacial abnormalities would be ear defects, dysmorphism, cleft palate, a depressed nasal bridge, hypertelorism. Central nervous system, hydrocephalus, microcephaly, facial nerve palsy, cortical and cerebellar defects. Cardiovascular, Vallett's tetralogy, which is a heart problem. Oh, but you knew that because it's under the cardiovascular section. Transposition of the great blood vessels, septal defects, aortic arch aplasia. Thymic, ectopia, hyperplasia, aplasia. Kind of hard for us to show that. Miscellaneous, spina bifida and limb reduction. So hopefully by now it should be pretty clear that in the case of oral isotretinoin, you probably shouldn't be getting pregnant. In the States they have something called the iPledge program, which is designed to reduce the risk of fetal exposure to oral isotretinoin. As you know, for anything, the dose makes the poison. However, in the case of oral isotretinoin, there is no minimum safe limit. The question is why? Why do these things happen when you take oral isotretinoin? So I know oral isotretinoin has a bit of a bad reputation. It's the bad boy of what to do with your skin. And since the year 2000, there has been quite an ongoing discussion about the potential risk of suicide ideation and suicide correlated with isotretinoin therapy of moderate to severe acne. This was all kicked off by the suicide of a 17-year-old son of a US congressman who blamed Accutane, which is another name for oral isotretinoin, it's a brand name, and he called the federal regulators to strengthen the warnings to the public about the drug's possible psychiatric side effects. So this young man shot himself in the head with his dad's gun. He was a very popular kid at school, apparently, and killed himself right after his prom. But for quite a long time there's been a lot of discussion about whether or not the oral isotretinoin really the cause of the suicidal ideation, because it's also known that there is some psychedelic impairment in acne patients, and indeed even all the way back to 1948 it was known that people who have acne sometimes struggle with social anxieties and depression. Quote, "There's probably no single disease which causes more psychic trauma, more maladjustment between parents and children, more general insecurity and feeling of inferiority, and greater sums of psychic suffering than does acne vulgaris." Furthermore, there was a study done by physicians in Yorkshire, woohoo, UK, that's where I'm from, which showed that 9 of 18 dermatology patients who committed suicide over 20 years were males who suffered from acne. But what's actually going on here? So I've taken oral isotretinoin myself, and interestingly, I felt fantastic. Like, I never felt better. Honestly, I felt amazing. I was getting up early in the morning. I had increased sex drive. I looked amazing. I was loving life. I'm telling you, I was like living my best life at that point when I was taking the Roaccutane. But why? Well, a vitamin A deficiency causes multiple effects on thyroid function, And as you probably know, the thyroid is like the thermostat of the body. So it decides how quickly everything runs. If you have thyroid problems, your thyroid hormones are too low, you're going to be running really slow. So you're going to find that you have problems with overweight, for example, or being cold. You'll feel like your brain is slow. It'll be difficult for you to get up in the mornings. You'll lack motivation. So there's a crosstalk between the retinoic acid receptor, the retinoid X receptor, and the thyroid hormone receptor. And I'm not saying that this is potentially what could lead to this suicidal ideation problems, but I just think it's interesting that oral isotretinoin is given a really, really bad name because of the, there's obvious issues, but also some people absolutely love taking it. So when I was taking the oral isotretinoin, it was before I was taking any thyroid hormones. And really that should have been an indication that I was having problems with my thyroid at that point. But you know what conventional medicine is like, right? It's like 20 to 30 years behind the science. The third thing I'm going to be talking about is doxycycline and tetracycline. So they've been listed as a category D drugs by the FDA, which is obviously not something that we have here, but we've got a lot of Americans in our audience, so I thought you might be interested. And a category D drug is one which has been shown to cause harm to the fetus, but the risks of doing so may be outweighed if there's a significant benefit to taking the drug. For example, in the case of an infection, because it's an antibiotic. So there are no control studies in humans, however. The Hungarian case control surveillance of congenital abnormalities, try saying that after a few drinks, 18,515 women with babies with congenital abnormalities. Of that group, 0.3% were treated with doxycycline, and they demonstrated that there was a marginally significant association. What kinds of abnormalities are we talking about? Well, that would be something like, for example, skeletal malformation. When used during tooth development, which happens in the second trimester, tetracyclines can cause a permanent yellow, grey, brown discoloration of the teeth and hyperplasia of the enamel. So the use of tetracyclines is not recommended during pregnancy for this reason. But when it comes to breastfeeding, there are a large number of reviews stating that oral tetracycline is contraindicated during breastfeeding because there's a fear it will lead to bone deposition of the tetracycline or enamel staining. This fear comes from the fact that the second teeth of children are not formed in utero, so they're formed while the child is growing. If you look at this table here, you'll see that the second molars, so that's your sevens, they're called different things in different countries, guys. Calcification begins at 30 to 36 months, and the enamel is complete at 7 to 8 years. And then for your wisdom teeth, the calcification begins around age 7 to 9 in the maxilla and 8 to 10 in the mandible. So obviously you don't want to be giving a child who's 7 to 8 a tetracycline because it's going to end up staining and possibly deforming their enamel. Side note, for those of you who don't know me very well, I used to be a dentist before I did medicine, so that's why I know about such things. However, there was a paper showing that short-term use of tetracycline during pregnancy was not thought to be an issue because the level of absorption into the breast milk is low. But in theory, I would avoid repeat prolonged courses. Number 4 is benzoyl peroxide. Benzoyl peroxide reduces the bacteria on the skin's surface to treat acne. Around 5% of it is absorbed through the skin and it's excreted by the kidney. I really like it as an ingredient. It's a bactericidal. Use of 10% benzoyl peroxide for 2 weeks has been shown to decrease P. acnes by 98%, which is crazy. And it also has mild sebastatic effects, so it reduces the sebum. However, the FDA classify it as a category C drug. So it can bleach your clothes, bleach your hair. There's some cross-reactivity to people who are allergic to cinnamon also. Category C is a bit of a confusing category because at the one hand you'll have drugs which have been shown to cause a mild harm to the fetus, but on the other hand you'll also have drugs in there which have not been shown to be harmful, but they have also not been shown to be safe. So there are no control studies in humans, although there might be studies in animals. Basically, it's insufficient data. The NHS says it's generally safe to use benzoyl peroxide during pregnancy, however don't use it on the chest during breastfeeding, and wash your hands before touching your baby. So basically some people say it's fine to use, some people say don't want to take the risk. I have used it a couple of times during pregnancy. I'm not sure that I would use it every day. Number 5 are your chemical sunscreens like oxybenzone, avobenzone, oxynoctate. These are chemical sunscreens and the FDA is currently researching the possibility of them being endocrine disruptors. There's quite a list of places which have now banned these substances. In Australia, it's allowed to use oxybenzone up to 10%. Canada, up to 6%. In the European Commission, it's allowed up to 6%. Japan, up to 5%. Interestingly, Palau, which is an island country in the Western Pacific, has banned the sale and use of any sunscreen and skincare products containing oxybenzone. Sweden has decided it's unsuitable for use in young children. It's also been banned in Hawaii and Key West. I just think it's interesting that people are having this conversation. Why? Why would they do that? So a paper in mice showed that exposure to oxybenzone altered mammary gland morphology. In this paper, those who had medium to high levels of oxybenzone in the urine were later found to be associated with giving birth to children with Hirschsprung's disease. This is a problem that affects the large intestine and basically means the baby can't poo. And it can be fatal for children who don't have surgery. However, after surgery, most children are able to live a normal life. Testing in human cell lines showed low levels of oxybenzone has the potential to disrupt cell migration. This is similar to the issue seen in Hirschsprung's disease, and enough can cross placenta to make this an issue. Oxybenzone is commonly used in sunscreen formulas at 6%, and up to 8% of it is absorbed through the skin. This is then partially stored in the fat and eventually excreted in the urine. Toxin storage in fat is a very interesting topic, and one that I would love to come back to at some point, because it's thought that this is one of the reasons why we can't lose weight these days. So even if you don't care about Hirschsprung's disease or mammary glands, you might care about weight. They did some fancy calculations in this paper here to prove these stats. Look up the paper if you're interested. In the meantime, if you're thinking about conceiving, I would recommend that you use a physical sunscreen instead if you can. Number 6, formaldehyde. Doesn't really sound like something you should be using. Well, the use of formaldehyde leads to an increased risk of birth defects and spontaneous miscarriage. Animal studies have shown that formaldehyde exposure is detrimental to the developing fetus. Formalin is commonly used during fixation for cadaveric procedures. Whilst it's easy to protect against physical contact whilst performing these dissections, much more of a concern is the airborne formaldehyde. Formaldehyde can commonly be found in nail varnishes, eyelash glues, hair gels, soaps, makeup, some shampoos and some lotions. In animal models, it has been shown that formaldehyde has a detrimental effect on the fetus, and interestingly, formaldehyde is more readily taken up by fetal tissue, specifically the brain and the liver. You probably don't want to be messing around with those. Not only that, but it's also eliminated a lot more slowly from fetal tissue than it is from maternal tissue. So a moderate increase in formaldehyde exposure increases the detrimental effect on the developing fetus very quickly. Interestingly, if iron deficiency is also present, those two things have an additive effect. Number 7, spironolactone. This is an anti-androgen used for treating acne in women. It has potential detrimental effects on the male fetus. In this letter to the Journal of the American Academy of Dermatology, a systematic review was carried out. Feminization of exposed males was observed in 6 of 9 animal studies. Of these studies, 5 studies used dosing greater than the human equivalent of 200 milligrams per day. The maximum dose that has been reported for acne in the literature is also 200 milligrams per day, which is really at the higher end. In humans, 5 males were born with renal disease who were treated with spironolactone before and during their pregnancies. There was no evidence of feminization despite exposure to doses as high as 400 milligrams a day. And indeed, because most women don't realise they're pregnant until at least gestational week 6, it's likely that many male fetuses are exposed to this drug while undergoing genital differentiation. But there are a super limited number of studies here, so I would recommend not taking it. 8, 9 and 10 I'm going to put them all together. So number 8, dihydroxyacetone, found in self-tanners. Absorption is very minimal, 0.5%. Some papers say no concern. Salts of thioglycolic acid, absorption less than 5%. Again, absorption is minimal, so not thought to be an issue. Number 10, hydrogen peroxide in hair bleach. Bearing in mind that if you're having your hair bleached, actually, if you're having highlights, the bleach isn't going to touch your skin. I'm putting all these under one category. And this category I'm calling miscellaneous random chemicals. Many of us think that we should change the use of our cosmetics during pregnancy. In this paper, the products most commonly given up by pregnant individuals were nail varnish, 10.3%, nail polish remover, 7.4%, and hair dye, 7.4%. Perfume was the most often decreased, 10.3%, and cosmetics most often replaced by others considered to be less harmful were shower gel, 10.3%, body lotion, 7.4%, and hair dye, 7.4%. Body lotion was the only cosmetic whose use increased during pregnancy. I suspect this is something to do with stretch mark prevention. In this study, 45% of those surveyed considered there was no risk in using cosmetics during pregnancy. However, it's now recognised that these products contain numerous potentially harmful chemical substances, including plasticizers, bisphenol A, parabens, synthetic dyes, benzophenones, antimicrobials, dioxine, formaldehyde, and heavy metals. Formaldehyde and dioxine are carcinogens, or probably carcinogenic. Certain synthetic dyes are suspected of being carcinogenic. Other molecules are endocrine disruptors. Exposure in utero to phthalates and phenols has been related to impaired male genital development. We can't have that. And exposure to TPHP, which is a plasticizer found especially in nail polish, has been related to a decrease in sperm concentration. Obviously, cosmetic users are largely unaware of these findings. As the majority of cosmetic products are applied directly to the skin, hazardous chemicals can sometimes cross the epidermal barrier into the dermis and enter the systemic circulation. This has the potential to damage fertility and affect pregnancy outcomes. This French case control study shows maternal prenatal exposure to phenols is inversely correlated with male birth weight, and 2 studies suggest pregnant exposure to phthalates is associated with preterm birth or pregnancy loss. Some studies show occupational exposure of pregnant women to cosmetic products, for example hairdressers or cosmetologists, is associated with miscarriage, perinatal mortality, preterm birth, low birth weight, and small for gestational age, and other adverse pregnancy outcomes. None of that is good. There's a retrospective cohort study in New York State which implied that licensed cosmetologists are prone to having low birth weight babies compared to licensed realtors. A recent meta-analysis confirms cosmetologists are under higher risk of infertility, fetal death, and preterm birth than the general population, which is crazy. But if you're just someone who's occasionally using cosmetics and you're not doing it every day, like maybe somebody who works in one of those fields, are you really at that much of a risk? Well, in this paper, comparing cosmetics users and non-users, cosmetic use was associated with an increased risk of small gestational age, but not preterm birth, low birth weight, macrosomia, or large for gestational age. It also wasn't clear exactly which chemicals were causing the babies to be small for gestational age. So I know I said I was going to cover ingredients that you can use during pregnancy, but I've totally run out of time due to the extensively well-researched nature of this YouTube video. So next time I bring out a video, I'm going to be talking about the skincare ingredients that you can use, and then the time after that I'll be talking about different cosmetic procedures that you could have done. Now would be a good time to subscribe to the channel should you wish to do so, and I'm sure you do. I hope you enjoyed the video, and I will see you next time. See you later.